So this is an answer to a request to do Chapter 19, homework assignment question 1.15. So let's go ahead and read it through. Patient is a 19-year-old female college scholar athlete. She's a scholarship basketball player at the State University. She's had repeated injuries to her knees over the last 7 years while she's playing competitive sports, including basketball, softball, and soccer. Over the past 3 months, she's noted a feeling of instability in the right knee, more than usual, with increasing pain over the medial compartment as a result of those old injuries. Physicians who treated her over the past year were confident that she had a torn ACL and possible tears to the medial meniscus and MCL. She was admitted to the hospital for reconstructive surgery with a plan to transfer her to a sports rehab unit at the University Hospital. At surgery, the orthopedic surgeon found grossly positive Lachman Sign and anterior drawer in neutral, internal, and external rotation. The medial meniscus was torn at the posterior horn in a complex fashion. There was no repairable tissue. The MCL was torn. The good news was that the surfaces of the patellofemoral joint, the medial compartment, and the lateral compartments were in good condition. The ACL was completely torn. The posterior cruciate ligament was intact, and the patellar tendons rode laterally in the notch. At the conclusion of the procedure, the knee was stable to Lachman for testing. Procedures performed were an arthroscopic reconstruction or repair of the ACL using patellar tendon graft repair of the medial meniscus and the MCL. Also known in the arthroscopic reconstruction or that should say also known as the triad knee procedure. Knee repair or Donahue procedure. After 3 days of postoperative recovery, the patient was transferred to the sports rehab unit for complex rehabilitation programs. So let's go ahead, and what I've done is to kind of save a little bit of time, I went ahead and I already pulled out everything that we needed to do and they have it written up here. So I'm actually going to move this one. Okay, so what we have is, as we go through this, she has a feeling of instability in the right knee and increasing pain as a result of old injuries. So here we're going to say due to old injuries, and here we're going to say due to old injuries. Okay, now that's going to be important, and it's going to be a little bit confusing at first, but hopefully I can get it, I can explain it well enough so that it'll get across to you. Okay, so then we have, they were confident that she had a torn ACL, so we have our torn ACL here, and possible tears to the meniscus and the MCL. So we have possible tear to the meniscus, right? And possible tear to the MCL. Okay. So they went in and they said that here at surgery, they say she was admitted to the hospital for the reconstructive surgery. They found that she had grossly positive Lachman sign. She had problems with her anterior drawer and her rotation, meaning when they manipulated her knee, there were issues, pain, and instability. And they go through and say everything else is fine, right? Except that the ACL is completely torn. We have that, right? It does say the MCL is torn. So now we don't have a possible tear, we have a confirmed tear, right? Okay, and we also have the medial meniscus torn at the posterior horn in a complex fashion. So we no longer have a possible tear of the medial meniscus, we now have a confirmed tear, and we know where it is. It's at the posterior horn complex, okay? Then they look at everything else. Everything is good. and they do a triad knee repair or a Donahue procedure, absolutely no reason to not use what they're actually calling it, right? To use the eponym. And then they send her to the rehab facility after 3 days post-op. Okay? So here's what we have to work with. So let's look at this. So, instability in the right knee due to old injuries. Now, instability in the right knee is a sign or a symptom of any of these tears. Okay? The thing you have to remember is that it's important to note they're due to old injuries. So, this torn anterior cruciate ligament is due to old injury. So, now we can eliminate that, right? Because we have confirmed diagnoses, right? Okay. The MCL, due to old injury. Okay. Now, increasing pain. It's going to cause the same thing. This is, again, an issue with the definitive diagnoses that we have here, so we can eliminate that, right? Okay. Now, let's go ahead. We know that this rotation and manipulation of the knee and being in pain is going to be as a result of this. So we're going to go ahead. That is a sign or a symptom. Now, Lachman sign, I know what that is, but you may not, so we'll look that up as we get going. So let's go ahead and get in there and code this sucker and see what we get. Now, we have a torn ACL due to an old injury. So let's go ahead and look at that. What could we say? Well, what we actually have is a tear or a torn. Torn. All right, let's pick number 1. All right, now we have here some things. We're gonna play with this a little bit because we have cartilage, articular, old, coded to sprain by sight, and we know that it's old, and we might be wanting to do that, but here we might be drawn to that because it's old and we have due to an old injury, but we also have cartilage to the knee. We also have ligament, don't we? And that's what we actually have. So I'm going to say let's try ligament first just to see what happens. We don't have an open wound, do we? Now, we have it in the knee, but again, we have chronic or old sprain. Now, it doesn't say that it's a sprain, so I don't know that we would want to code it to a joint derangement. But let's try knee and just see what happens. Now, sprain of knee, and we have it of what? Of the ACL, which is the cruciate ligament. So we're going to pick 4 and see what happens. Here's where it's asking us, is it a current injury or is it old? We know it's old at this point, don't we? Due to old injury, so let's say old. Now it's going to ask us if it's anterior or unspecified. We know it's anterior. With tear of cartilage or meniscus of knee, do we have over here a tear to the medial meniscus? We do, don't we? So let's go ahead and pick that. And it looks like we're probably going to end up getting at least 2 codes out of this, right? So it's to what now? Meniscus involved is the medial meniscus, correct? So let's pick that. Okay. Now we're going to click continue. And it tells us exactly where it is, doesn't it? Posterior horn. So we're going to go to posterior horn. Now, we've coded, so far we've addressed the ACL and the meniscus. Now, could we continue here? Because Don't we have another one? We have the medial collateral, or the MCL, don't we? Let's look and see. Well, look at that. Collateral. So let's try it. We've already coded that, but let's go ahead and go through it again. Medial meniscus. Okay. The injury is recurrent or old, isn't it? The meniscus involved is the medial. Continue. Posterior horn. And we don't have any more sprains, do we? So let's look and see what we have. We have 71783, old disruption of anterior cruciate ligament, which is what we have, isn't it? Torn anterior cruciate ligament due to an old injury. Okay. Derangement of posterior horn of the medial meniscus, which is 717.2, which again, is that not what we have? Tear to the medial meniscus, posterior horn. Let's go ahead and get rid of that. Then we have old disruption of medial collateral ligament, 71782. Is that what we have? Tear of the medial collateral ligament due to old injury? It sure is. So let's go ahead and cross that off. Okay. Now, why did we code old disruption or old and not current? Because they're telling us they're old. A current would be basketball player is fine, not had any injuries to his knees, no problems whatsoever, and he's playing a game and bam, he gets hurt and he's got an immediate tear. That's going to be current. This is saying she's had repeated injuries over the last 7 years, and they're pretty sure she's torn stuff in there, and that knee is just a hot mess inside. But they haven't addressed it. They maybe have done physical therapy, medications, those types of things, rest. But now it's at a point where it's totally disrupted and they need to go in there. It's old. People could have these types of injuries for years. So if it's current, it's bang, it happens, and they're in the hospital having it fixed. If it's old, they could have it for several years. They've tried other things. So now they're going in and they're going to finally have surgery as a last resort. That's when it's going to be old. It gets worse. Okay. So we've coded those. Now we do have something over here that we just are not sure what it is. It's the Lachman sign. So let's go ahead and look it up in our references just to see. Just so we can see what it is. So let's try Dorland's. Actually, why don't we try the Merck manual? Why not? No, let's go back to Dorland's. I think that'll be easier. Dorland's. Okay. Lachman test. It's an anterior drawer test for cases of severe knee injury performed at 20 degrees of flexion. So now what is this anterior drawer test? Let's see, now it says see drawer tees. Drawer tests, the knee is flexed to a 90-degree angle at the femoral tibial junction. If the tibia can be drawn too far forward, there's a rupture in the anterior ligaments. If it can't be drawn too far forward, there's a rupture in the posterior ligaments, also called drawer signs. So basically, do you remember when we said manipulation of the knee? That's what that Lachman test is. All right. So do we need to code a grossly positive Lachman's test? No, because that's what tells us that these things are going on. So we can go ahead and cross that off, can't we? All right, so now we have one last thing to do, and what do we have to do? We've got to code that triad knee repair. So let's go ahead and say add a procedure, and I'm just going to put in triad. Bang, number 1, triad knee repair. 8143, and that's it. That's it. That's all you have to do. Because remember, when we're talking about ICD-9, a lot of times there is nothing to differentiate in the codes between arthroscopic or robotically assisted procedures versus open procedures or traditional procedures. That comes with one of the reasons we have ICD-10, right? Okay, so now we can cross that off, can't we? Let's go ahead and cross it off. Have we got them all? It looks like they're all crossed off. Let's hit continue. And that's what it should look like. Now, when we're talking about the principal diagnosis, the anterior cruciate ligament and the medial collateral ligament are probably going to be about the same. So it doesn't really make any difference, okay? I would not put the derangement of the medial meniscus first. In fact, I would probably move this down here because this is something that can happen along with these two things in this instance. So that's what you should look like. Okay, we've covered it all. So just break it down. Don't be afraid of it.